Good morning, students. Today we are going to talk about the diabetes. It is one of the topic under the chapter Yoga and Lifestyle. My dear students, one of the very common health rates diabetes is badly spreading in India. So it is always a matter of research that can we have a check on diabetes like health hazards through the yoga and our lifestyle. So here we will talk about few yogic exercises through which we can have a control on diabetes. So before explaining about the yogic exercises, I want to tell you that diabetes is a disease related with the pancreas and its secretion, that is insulin. Generally we can find two types of diabetes, type 1 and type 2. Type 1 diabetes is generally found in children and it is maybe due to the heredity, but type 2 diabetes instead of type 1 always we find it in the adulthood due to the bad lifestyle, poor lifestyle, bad intake of eatables. A person can be suffered from type 2 diabetes. Type 2 diabetes sometimes does not show any sign and symptoms, and only we can get the type 2 diabetes diagnosed through the medical checkup. So here I want to explain or tell you about 5 yogic exercises one by one through which we can control the diabetes. The first asana which we can practice to cure the diabetes or control the diabetes, that is Bhujangasana. Bhujangasana can give different benefits on our health status. It stretches muscles in the shoulders, chest and abdomen, decreases stiffness in the lower back, strengthen arms and shoulders, improve menstrual irregularities. It also firm and tone up our buttocks. It also regulates the blood circulation, but some kind of contradictions are also there, like we should not perform this asana during the pregnancy. If the person is suffering from hernia, back injuries, headache and just after abdominal surgeries, we should not perform or allow anyone to perform this Bhujangasana. If the person is having some kind of problem related with the wrist, he or she must not perform this asana. Bhujangasana is one of the best and most common yogasana through which we can have a control on this kind of problem. If a person is suffering from diabetes, must perform Bhujangasana every day, and only through these asanas, this asana, the person can have a control on it. The second asana is Paschimottanasana. This asana is one of the 12 basic postures of Hatha Yoga and is also a part of Stanga primary series of Paschimottanasana. It is considered to be a calming posture for the mind and nervous system. It may also be used for anxiety and depression patients. Paschimottanasana is also known as seated forward bend. How we should perform the Paschimottanasana? Sit up with the legs stretched out, straight in front of you on the floor. As you can see, keep the spine erect and toes flexed towards you. Bring your respiration to a normal status, breathing in slowly. Raise your both the arms straight above your hand and straight up like this, and you have to do the stretching. The benefits which we can get through this exercise: improve digestion, stimulate the liver, kidney, ovaries and uterus, stretches the spine, shoulders and hamstring, calms the brain and helps relieving stress and mild depression. It also soothes the headache and reduce anxiety and fatigue. Few contradictions are there. Those suffering from lungs disease or spine problem should not perform this practice. If the person is having some kind of liver or spleen disease, must not perform this asana. So here it was the second asana. Third asana is Pavanmuktasana. Pavanmuktasana, also known as the wind relieving pose, is a reclining posture. The Sanskrit name Pavanmuktasana is made up of three Sanskrit words, Pavan, Mukta and Asana, where Pavan means wind, Mukta to release, and Asana means posture. Practicing this asana helps relieve constipation and gas from stomach and intestine. While doing this exercise, we try to tie up your both legs with our hand and we put stress on our leg so that it can have a creating pressure on stomach. Also, we try to put up our head, stretch the arms in such a way that both the knees must be stretching towards the shoulder. Stretches the neck and back, help decrease gas in intestine. It improves digestion. It also stimulates the secretion of insulin decrease stress, it gives soothing effects on our mind. If person is having recent abdomen surgery, must not perform this asana. Anyone suffering from hernia or piles should avoid this asana. Pregnant women should not practice this asana. If there is any pain, suffering from any injury related with the neck, head should remain on the floor and can practice this asana. One more asana which was earlier discussed in the video, that is Ardha Machendrasana, can be practiced to reduce the effect of diabetes. So here in this lecture, I have discussed about the asanas related with diabetes and its cure. In the next chapter, in the next topic, we are having asthma, and we will talk about the asanas which can cure asthma. So till then, goodbye. You will study it. The PDF is already sent to you. Thank you. Have a nice day.